My name is John Allendorf. I'm the Vice Chairman of Surgery and the Chief of Surgical Oncology at NYU Langone Hospital, Long Island, and the Long Island School of Medicine. I take care of patients who have surgical diseases of their thyroid, parathyroid, adrenal glands, and their pancreas. NYU Langone Hospital on Long Island is the only full-service hospital that is also an NCI-designated comprehensive cancer center. There are 3 comprehensive cancer centers in New York, but we're the only one that does surgery in Long Island. So at the others, you have to travel to Manhattan to have your surgery, and then you may get your chemotherapy or radiation out here in Long Island, but you don't have that whole team working together all in the same place. You're going to achieve your best possible outcome if you can have all your doctors working together and they all know each other and all sitting in the room together talking about your care on a weekly basis. And the only place you can really do that on Long Island is with us here at NYU Langone. In my field, I think there are 2 technologies that are likely to be disruptive. One of those is robotic surgery for pancreatic cancer. There are great advantages to the minimally invasive approach for patients with cancer that need surgery. The recovery time is shorter, the blood loss is shorter. When you do less to disturb the normal physiology of a patient, they recover more quickly and they can get on to the next phase of their care more quickly. The second disruptive technology in my field is something called radiofrequency ablation for thyroid nodules. Now, radiofrequency ablation, like the robot's been around for a long time, but the engineers have been able to make the probes so delicate and so small that we can now treat nodules in the thyroid without destroying the normal tissue around it, the critical structures, the parathyroids, the trachea that you breathe through, the nerve to your voice box. So what I used to have to do an operation for, take out half the thyroid or all of the thyroid, we can now, in an operating room under general anesthesia, now we can often do it with just a needle stick in the neck in the office, which is a dramatic difference for the patients. And also you're removing very little, if any, normal thyroid tissue, so there's better preserved thyroid function. So that's a technology that's just starting to take off. We're leading that charge. And I think in the very near future, it's going to replace a lot of thyroid surgery. You know, my philosophy of taking care of the patients is to try to take the emotions down one notch and have them understand that there's a whole team of people that I'm working with and myself are going to help them achieve their best possible outcome, whatever that might be.